So with that, I'd like to introduce Jules Abate. She has been employed with the ARC of Montgomery County since 2006. She currently serves as the Respite Administrator, overseeing the administration and coordination of respite care for caregivers caring for children and adults with disabilities and frail senior citizens who live in Montgomery County. Jules has extensive experience working with families, providing them with resources for county and state programs. She has developed and maintained a large consortium of home health organizations, respite facilities, adult medical day programs, and therapeutic programs, which families can select as respite providers. In addition to her work at the ARC, Jules has served on the home and community-based services for age-friendly Montgomery and dementia-friendly Montgomery communities. Jules has worked as a direct care professional for children and adults with disabilities as a certified dementia practitioner. So with that, I'm going to stop sharing, and we're going to switch over to Jules's slide deck.
Hi, everyone.
Yay,
it's so nice to, let me see if I can share this with everyone first. Okay. So, hi to everyone, especially hi to so many familiar faces. Heidi, so good to see you. Mrs. Dwyer, nice to see you. And there's a few other respite families already here, so it's wonderful to see some of you for the very first time. So I want to thank Joy and Brooke for having me come tonight. We're going to talk about respite coordination. Okay. So, again, my name is Julia Abate. I'm the respite administrator with the ARC of Montgomery County, but everyone knows me as Jules. Our website's here, and the overview of respite coordination is on this link. Okay, so let's see. So respite coordination, what is it? The ARC of Montgomery County was awarded the contract to administer and coordinate the system of respite care for Montgomery County caregivers. Our primary funding source comes from the Department of Health and Human Services. What's respite? Well, respite actually comes from the French word to take a break. So respite is designed to give a caregiver a break from caregiving. It provides short-term temporary relief to the caregiver. Respite care can help ease the burden of a family caregiver and help to relieve stress, restore energy, and promote balance in your life. Just keep in mind, respite is not designed for ongoing care. So who's eligible for respite? So I think this is where a lot of families get confused. So we're definitely going to make sure everybody understands that tonight. The ARC of Montgomery County can coordinate short-term respite for the unpaid live-in primary caregiver who lives in the same Montgomery County household and is caring for a child or an adult with a functional disability, such as cancer, MS, advanced diabetes, lupus, a child or an adult with an intellectual disabilities, a child with a challenging behavior, and a frail senior. And so currently families are eligible to receive 140 hours. Now, who do we consider a child? From ages 0 to 17, an adult is 18 to 59, and our seniors are 60 and older. Right now, currently our oldest participant that receives their caregiver receives respite is 106. We're supporting about 180 people in their 90s. So these are some examples of primary caregivers: spouse caring for their spouse who has dementia, a parent caring for a child with autism, a sibling caring for a sibling with MS, a grandparent caring for a child with a disability, a partner caring for a partner with a heart condition. So you may not be eligible to apply for our service if your loved one receives any kind of state, federal, or military veterans funding. for in-home services. Okay, so we're going to talk a little bit more about that because I think that's where people get confused about. Okay, sorry. So now, how do you go about applying for respite? So you visit our website. We have right here, and again, there's 3 applications on our website. So they're broken down by age group that I have here. You can click on those links below. Just another tidbit about, the population we serve. And our oldest caregiver is 93 years old, and she's caring for a 98-year-old spouse. That is crazy, isn't it? We have so many seniors taking care of seniors in their 90s. Hard to believe. Okay. So the application process is you go to our website, make sure you submit all the supporting documents noted on the application. There's a checkoff list, so you want to make sure you complete that. If your supporting documents are missing, we won't process your application. Please allow 30 business days for us to process your application, and you'll be notified by email. And then I will provide you with a family orientation about the guidelines of respite. Okay, so after you've been approved, I provide you with an orientation, and we'll go all over the guidelines and explain the number of hours, explain the level of care. We have 2 levels of care, non-skilled and skilled. Most families enrolled in our program have non-skilled care. In addition, I talk to the families how they can use their respite hours. So you can use your respite hours in different settings. You can use it for in-home, adult medical day, if you're a senior, a respite facility. For children, we use Jill's House. You can use your respite hours at Jill's House. And you can use your hours for therapeutic programs and camps. And this is mainly what families use who have children and adults with intellectual disabilities. So we work with Spirit Club, Potomac Community Resource, Upcounty Resources, Spirit Fit and Health, ArtStream, Live Up, Camp House. So those are some of the programs you can use your respite hours with. So when people think about respite, they just think it's in the home, but it's not. So you can use these respite hours to subsidize payment for these programs. Okay, let's see. Okay, so the big question is what that I always get. I probably make too much money. I can't apply for it. That's not true anymore. Since 2020, when COVID broke out, I advocated to the county to lift all the income restrictions. If you had a child or an adult with intellectual disability, there was an income fee. That has been lifted since 2020, and I've been advocating every year since to keep it. So that is the good news now. There is no income requirement. You must just be the primary caregiver residing in the same household in Montgomery County to be eligible for the service. And most people don't believe that, but it's true. So it's changed a little bit. Who's not eligible? So that's a great question to ask. A lot of people think that if their adult child is receiving day and employment services, they're not eligible for respite. That's not true. They're not eligible for respite if they receive personal support or residential services, or if they have a self-directed budget that allows for in-home care. Okay, does that make sense? The only thing we don't allow for an adult with a disability, if they receive employment day, we don't allow you to use your hours for camp because you're funded for employment and day. Okay. We also have on our website, we have an FAQ. There's general overview about the program. And our application just about has every guideline in the application. So families will initial it and hopefully read it. And then I provide you with the orientation. So that's respite in a nutshell. So I'll be happy to take any questions.
So folks, you can raise your
But
hand. You can put the questions in the chat. I think I heard somebody come on.
yeah, I don't see a hand. So can I just ask the question?
Sure.
Sure. Yeah, yeah, go ahead. Is
Okay.
that Vicky?
Yeah.
Yeah, hi, my name is Vicky Apple, and my son is Jeffrey Erickson. He's
Oh, hi.
33 and he has Down syndrome.
Mhm.
And I have a question. About a year ago, we converted over from the traditional model to self-direct.
Okay.
And he does receive personal support. I am his personal support right now, along with one other person that helps out a few hours. I don't have family. Um, I have a daughter, but she doesn't live near here. So I did hear you say if the live-in, and Jeffrey does live at home. So I am his caretaker. I am also his personal support 40 hours a week. I had last year, I had an incident where I needed to be hospitalized, and my daughter was not available immediately. And I actually had to have a neighbor watch my son for like one night. So I guess my question is like in the future, if something happens to me where I can't be his personal support, and let's say my daughter, she's a frequent traveler, is not here, is there a way I could get emergency respite? Because I obviously can't, like if I'm in the hospital, I can't provide personal support hours and I can't be his caretaker. And a lot of other people that I know, and a lot of the other families that are under self-direct have that same question.
Yeah. Okay. So unfortunately, as I said earlier, you must be the unpaid live-in primary caregiver.
Okay.
Since you're being paid, you would not be eligible for our services. But I'd like to make a recommendation. First of all, DDA respite and
Yes.
county respite are two separate programs. Okay. We
Oh,
do not
okay.
receive any funding from DDA. Now, what happens is when your service coordination, when your service coordinator, if you request DDA respite, they give you a link to all the DDA providers, and the ARC is a DDA provider. However, we do not provide DDA respite. In fact, there's only two places that I know that provide DDA respite, and that's a problem. And we're planning another meeting with the coordinators, but we are not DDA funding, and so that's
Okay.
very confusing because all your coordinators are telling you to call the ARC because there's respite coordination, but it's a completely different program, and it's very confusing. We actually put it on our FAQ 2 weeks ago because I get daily calls from coordinators wanting respite care. So, Heidi, I might ask you for your expertise. My understanding is that if you need emergency respite, you can request it from DDA. But the problem is
Then
finding
you have to
that
find
provider.
someone, right? And yeah,
Right.
because I was trying to do a little bit of research just because I
So,
know that I can get respite hours, but where do I find the person to provide or
and
the provider?
yeah, the problem is there's not a lot of DDA respite providers, but I don't know. I'm not as familiar with self-directed. Do you have to pick a DDA provider for self-directed respite?
No,
How do
you can pick anyone. It can be
Okay.
a family member, it can be a friend, it can be
Well, that's easy then. Just let me know, and I can connect you with a lot of. So we have a consortium of home health care agencies that may be able to support your child, and you can use the D. And if they'll accept DDA funding, you can reach out to them to see if they can provide you care.
oh,
It doesn't come
great.
from,
Mhm.
even though they're consortium members of the ARC, you can still use them because many people pay for their respite privately.
Thank you.
So
And I
there's
will
an
share that
agency.
information.
There's an agency. There's a couple of them. Sandra's Nursing. don't let the name fool you. She's very experienced in working with transitional youth,
Okay.
with autism and other disabilities. Uh, she used to own a respite facility called My Sister's Place. During COVID, she had to close it down, but she's getting ready to open a new house for respite. And it could be for any respite, whether it's from the county, the ARC's Respite Coordination Program, or private pay. So that's an option. There's another agency called ANC, and I could put all this in Ebony House. And what I'll do is, Brooke, I'll send this to you, and then you can share it with the group. So, but if you have any questions, you can reach out to me. My contact information's in there, because that's a huge problem that families are having.
Yes.
And it's so crazy that everybody has to jump through these hoops to find a provider. So as long as DDA self-directed allows you to pick anyone.
It does, yeah.
Yeah. So I can give you a couple contacts that you can be in touch with. Be happy to do that.
Thank you so much. Oh my goodness.
Just let them know that this is not county respite, it's DDA respite. Okay.
Great. Thank you.
I'll be able, and we also have a couple other consortium members that are one is Renox. They're a autism waiver provider, and they're also a DDA provider, and they have an employment and day program. So there's a couple of them, not a whole lot, but there are a couple. That may be easier than finding finding an agency that has a group home that has a spare bed with spare staff. That doesn't happen. We all know that,
Yes.
and people just need to be upfront about that. That just doesn't happen. So, but I think these agencies may be able to help you as long as that. I think in traditional, Heidi, is it true that in traditional programs you have to have a DDA provider for traditional respite? Is that true?
I don't know about those that they are.
We're trying to convince, since there's such a shortage of DDA respite providers. I've been wanting to speak to DDA about, okay, why does it have to be a DDA provider when you're giving people lists who don't provide respite? So why can't we help families who desperately need it? Okay. Yours is a perfect situation where we've had multiple families that the primary caregiver has been ill. There's no one to take care of their loved one. Then Adult Protective Service gets involved in it. So yeah, that happens a lot, and it shouldn't happen. It shouldn't happen. You all have to. Everyone has to have a backup plan.
And a lot of us have, like, my parents were my backup, but then
exactly, and that's
now they're not here. Yeah.
Yeah.
And I don't have siblings, because usually, but that is a common. I mean, I have a group. There's probably 20 families that are self-direct in the area, and a lot of them go to the same program during the day, and we're asking each other the same question. It's like nobody knows the answer. So I said, I'm going to go to a webinar and get some answers.
Well, I just think that it's, people go to DDA, they get that link, and it literally happens every single day to me. So just keep in mind, our program is totally separate than DDA respite. So thank you for that great question.
Thank you for the clarification. I really appreciate it.
My pleasure.
And I can also share what I'm learning here with others that would be eligible for the county respite.
Right. So as long as there's a primary caregiver taking care of a loved one, and you're unpaid, and you're and if your loved one is getting employment in day, they're transitional youth, you can still be eligible for county respite. We just have a certain limitation, like you can't use your hours for camp, but you can use it for in-home or therapeutic programs.
Okay, great.
And no income restrictions right now. So please apply.
Yeah, thank you.
So Jules, we have a hand raised, and then we also have a question in the chat. The question is respite available to check in on a 17 or 18-year-old with autism in order to go on a vacation or pick up a different child at college, like a 3-day trip? What sort of check-in services might be available? She doesn't need someone in the house, but may need help waking up, having a nutritious meal, etc. We are not in any disability programs as of now, except for doors.
So respite is designed for short-term temporary relief. A lot of times when a parent has to go out of town for a couple of days, if they're, how old is she?
She's 17 right now.
Yeah.
And
So 17, 17, I don't think most agencies would feel comfortable leaving a 17-year-old a home by themselves because there's liability associated with it. So what we could do is try to connect you with, and right now we don't have a facility open, but we are working with an agency, Sandra's Nursing actually, to reopen a respite house where they could stay there for 3 days.
So she's kind of like homebody, like not eager to leave and go somewhere. She's almost 18, so that would change things so that.
So again, what I would do is recommend, so in respite, she seems like she would be deemed what we call non-skilled level 1 care. So any agency that comes in cannot administer medication. They cannot transport. This is part of our scope of services that we're required to make sure that are administered. So they can't do medications administration. They could do a medication reminder. Yeah. They could prepare a light meal, have help with activities of daily living. Now, most agencies want at least a 4-hour minimum, but that's something you would have to talk to the agency about, how comfortable. And all the agencies that go into the home have to do some kind of assessment. So they would need to do an assessment, meet with you, and discuss your terms. But that you should be, if your daughter's living with you in Montgomery County in the same household, not receiving any services, you should be applying.
So just go to the website and
just go to the website.
There are agencies that can do this sort of service rather than like, you know, babysitters or, I mean, we have, it's tricky. It's just kind of getting to a borderline age, but were we to go away, I think for more than 2 days, like whether she would eat properly.
Totally understand that. That happens a lot with our seniors. Some of our seniors don't want to go to a facility. They get really scared. So the family uses 10 hours. You can use up to 10 hours per day for in-home respite. So 10 hours a day, if you went away for, 3 days, you could possibly use up to 10 hours. No overnight is allowed for in-home respite. Okay. Only time we can do overnight hours is in a respite facility. If your child goes to overnight camp, we still limit to only 10 hours a day. So it's always 10 hours a day unless your respite hours are be used in a respite facility. Okay. So whether it's in the home, adult medical day, a therapeutic program, or a camp.
So I'm sorry, I'm like such a beginner at this, but
that's okay.
So like we pay for this or how much?
No.
Like,
so that's a great question. Thank you. So you're eligible for 140 hours. So the ARC has the contract to administer and coordinate it. The ARC does respite coordination. The ARC does not provide the direct care. We work with these agencies, therapeutic programs, adult medical day. And what we do is we subsidize the payment. So we can pay, currently our rate that we can pay is $33 an hour. So most of the agencies that we work with accept that rate. Okay. Then we authorize hours each month based upon what you need. Within the guidelines, no more than 10 hours a day. And then we pay them directly. We can never pay a family.
And do we have to be like apply and be approved? Like the website
the first step is always to apply.
Okay. That's great.
Yeah, and I'm willing to even set up a appointment if we can get your group in one day to come into the ARC. We can make sure you have the application, fill out all the forms, including the physician help form, and I will approve you on the spot as long as you have all the documents. And then we could connect you with our providers.
Okay. And sorry, I don't want to monopolize. I could ask you separately or email you. I don't want to monopolize the time because I'm just learning, but it sounds great.
I'm in the same boat. I'm just learning about all this. So
It's okay. That's
you
fine.
can ask all you want because it may help me out.
Yeah, please don't. Linda, you have a question?
I do. And like Alyssa's mentioned, I am a very newbie to respite care. And you mentioned DDA. I guess I'm getting confused. So DDA is through Montgomery County. Is that a governmental?
So, and excuse me for speaking in acronyms. So DDA
That's
stands
fair.
for Developmental Disability Administration. I should never assume that everybody knows what that means. So
Okay,
my
no, that's fine.
apologies for that.
That's okay. I was just trying to make sure I knew where to go because I mean I'm a single mom and my child is nonverbal. She actually suffers from shaken baby syndrome. So she's 14. She's almost as big as me, and I need a break. I really need a break. So I tried when she was a baby, but nothing ever came from it. And I don't remember where I applied or how I applied. I remember I had a case manager at that point, and that I filled out tons of paperwork, but I don't know where it went. My daughter also attended the CareSick Center until she aged out at 10. So she's kind of in between. I've been having a very hard time trying to find programs that will take her like in the summer because I work a full-time job, and getting programs. She's so dependent on others that some of the programs that the ARC did provide, she wouldn't qualify for because she is so dependent on others. She needs to be changed. She needs to, I mean, she's very cognizant of where she is. She gives attitude like you wouldn't believe, but she doesn't talk. She can't steer her own like wheelchair around. She would need to be pushed. So these past few summers during the pandemic, it was good because everybody was shut down. I didn't have to really worry about it. This past summer has been very stressful between work and trying to find something to do. They actually allowed me to do 100% remote, but I can't find it anymore. So I don't know that that's going to be offered next summer. I don't know. I just want to get hooked into not just respite care, but also programs for her because she thrives in these kind of programs. She loves being around others that are like her. So I didn't know. I was hoping this would kind of lead me into where I can go to apply for different services or even look for different services.
So
I did reach out to the Department of Human Services, Aging and Human Services, I believe is what it was called.
Aging and Disability, yes.
Aging and Disability. They would not give me a list. They wouldn't tell me anything. They were worried that they were going to endorse a certain group or something because I really thought if I reach out to them, they may have a list of programs, different programs like for the summer or whatever for my daughter. And they said they had no such thing. So
I am so sorry you got that. Usually they're very helpful.
Yeah.
But okay, so I think you should apply for respite. Okay. That's the first thing. There's a children's app. Then there's a great program that many of you parents know about. It's called MC Transitions. That is going to, and you've got an expert. The most expert person I know here is Heidi DePaula. She is someone that I admire so much. We've worked together in the past, but she will help you get on the path for getting services when your child is an adult or possibly services now. You may be eligible for some services. A lot of it is Medicaid based, which is unfortunate, but there are some programs out there. I will be completely honest with you. I believe in total transparency. A lot of therapeutic programs out there, if your child requires one-on-one, it is very difficult, but there are a few out there. One that I can think of is the Easter Seals Camp in Camp Greentop. If your child is not does not toll it independently, they will take you. But I've got to let you know, those programs fill up quickly.
Yeah.
So there's Easter Seals and Jessa, and I'll be happy to send this by email to everyone, okay?
Well,
There are programs out there. And just so you know, just because you're eligible for respite doesn't mean your child's going to be eligible for this every list on here, okay?
Right.
So I think that's important.
I was just hoping to maybe kind of do like a networking kind of thing and see if I could find others that may have suggestions or, websites that I could check out. But I'm just, it kind of boggles my mind that there are no programs that are readily available for my daughter between the ages of 10 and 18. So it's kind of like, where do these kids go, between those age range, in that age range. And so
there's a couple programs. Heidi, can you put in the link to MC Transitions? So this is a great listserv for parents, and you could pose that question on the website, right, Heidi? Can we unmute Heidi for a little bit?
Oh, here.
Thank you, Brooke.
And MC is a group of families together, just like we have the Down Syndrome Network. We have MC Transitions for everyone that wants to be part of it, with all disabilities, everything, all not just Down syndrome. But and you can join the group and ask any questions you want. I'm sure somebody will answer you, because parents are so fabulous, and not just parents. Sometimes people are there, they are professionals, and they are like in the background just listening. If a parent doesn't answer, they will jump in and tell you and help you.
How many people are members of that listserv, Heidi?
Don't know, I don't know, at least 500 or something. So
it's a lot. And they answer every morning at 6:01. I get a message from MC Transitions. They have somebody's posted a question on there.
And there's
6:01.
You shouldn't join just one. You should join MC Transitions and MC Needs, all of them, all them, and gather them
all of them.
So you can ask your questions and people answer. You never know where the answer is going to come from.
Right, exactly.
But you can meet people in person. It's coming up. Is that November, October? I'm confused now. That the Transition Youth Resource Fair. It's a fair. You'll see all these people in one spot. At what is going to be the place now? Jules, do you remember?
Is it? Usually it's Montgomery College. It's going to be different.
Yeah.
Oh.
So I'll post it. I'll get it and I'll post it. I'm just blanked out right now. But
so should we leave out your email address? Because I don't want to monopolize everybody's time. I thought, do I need to leave my email address like in the chat or?
Yeah, and then Brooke, could you send me all those?
Yeah. So
what you could do is this. So my email is this.
Yeah, I was just going to say, we will, this presentation is being recorded. And so when afterwards, sometime in the next week, it'll be downloaded and we can share the presentation with you, along with any kind of resources that Jules shares with us. We can follow up with everyone to make sure that anything that Jules says or Heidi says, they can get it to either myself or Joy, and that it'll be in the follow-up email.
Okay.
It's probably easier rather than having Jules copy down everybody's addresses for you to contact her directly. And so just because it gets to be too much. One question that just follows up on some of what you've spoken. When you say 140 hours, you mean per year?
Per fiscal year. Our grant is in a fiscal year cycle, not a calendar year. So our fiscal year starts in July and ends in June. As long as we have funding available, you can access your respite hours.
And so, and I'm just kind of asking some general questions. So for example, you mentioned Camp Pals, and I know that a lot of families from within the Down Syndrome Network send their teens and young adults, and just generally adults, to Camp Pals or some other summer program.
Live Up,
or Live Up, and I'm wondering, is that how it's pronounced? I thought it was just Live Up,
I thought it was,
but maybe not.
maybe you're right. Maybe you're right.
I have no idea.
Yeah.
Because they're somewhat a newer.
They broke off from Camp Pals, right?
Yeah, I think it's a fun group. They do a lot.
Yeah.
But anyway, so for example, for this temporary or short, as you call it, short-term temporary relief. So when I think of like a camp, let's say it's 7 days long, and somebody is sending their loved one with IDD to a camp, whether it's Camp Pals or some other camp, and you say it's 10 hours a day and it's $33 an hour. So
up to 33.
Up to 33. So that could be, let's say, $330 an hour. I'm sorry,
No.
a day.
Yeah. So if the camp is 7 days long and we can only approve up to 10 hours a day, and they'll be there overnight. So we take 10 hours because it's overnight, times 7 is 7. We would approve 70 hours. Let's say the cost of the camp is $2,500. So we take the cost, $2,500, divided by 70 hours, and that's $35.71. We could, per hour, we could pay up to $33 an hour, and the family would have to pay the difference.
Okay. That's what I wanted. I was just trying to think of how people would,
so
manipulate that financially. So because these camps are very expensive.
It's not a financial assistance program, even though it helps you out financial, but you're eligible for respite hours that equate to a subsidy to pay for those programs.
Right.
Yes. Someone
I think Alyssa.
Yeah. I just had another question since it was invited. So, our child has autism and definitely has quirks, and definitely certain things like really bother her.
Mm-hmm.
Like how much, like, how much expertise do the people have that come in, and like how much chance is there to talk to them about, like, okay, she doesn't like bright lights, or doing noises drive her insane, don't eat with her, or whatever. I don't know.
Okay. Yeah. So first of all, when you submit your application, we enter that into our database, and then that database generates what we call a participant profile. When we've identified a vendor for you, an agency, in this case, a home health care agency, we send that profile to the agency. The agency then contacts you to do an assessment of your child with you. So they'll get to learn a lot about that child through their assessment. Like, don't do this. We have a lot of families that have very specific things that their children do not like. So they'll go into your home, do an assessment. They'll try to identify an aid that can support your child. And sometimes they get the right one right away. Sometimes you might have to go for a few of them. Again, I want to be as honest as possible with all families, because I think families rather hear it directly than like make things everything's nice and smooth and easy. It's not. Nothing's like that in life, especially when you have a child with a disability. It's not easy. It's sloppy. It can be messy, and it be just a real pain dealing with these systems and programs. So, but they have to identify someone that has the skills and abilities to support them. But more importantly, you have a child with autism or any kind of special needs, you want that connection. Your child has to feel that connection with that person. And if they're not going to be happy with them, they're not going to really get out of it. You're not really going to get a break either. So that's important. So sometimes it takes a little bit longer. We have families that have several children with autism in their home, siblings. We have a family that has 3 children with autism, and we're able to support them. It didn't happen overnight, though. So I just try to be as transparent as possible to families.
So do you recommend, let's say somebody is thinking, you know what, I could really use that help over the summer? Because I mean, I think Linda that's a really common question. all of us are like, okay, our kids who are, 21 and under, or under 21, go to school all day. And so while we're at work, they are taking, they're in school, like any of our kids. And so in planning, let's say for next summer, and we think, okay, well, it would really be super helpful to have, some kind of respite care, whether it's through camp or something else. Do we apply now, not knowing exactly what that program or respite choice is?
Yes,
so that
you
we're
want to
in the
apply.
system,
You
and then
want,
identify it later?
Yeah, so first of all, we have an enrollment period to apply, July through March. Why do we have an enrollment period? Because every year, a family that's already enrolled in respite has to renew. So we had 600 families enrolled in respite last year. So we can't take on new applications and enroll people and re-enroll people at the same time. So, and another thing is, some camps, registration will start in November. So those things you want to watch out for, those camps, especially those camps that do one-to-one, you want to look out for those. And registration seems to be open earlier and earlier for camps and summer programs. So you want to apply, because we want to be able to identify a program for you. You want to be able to meet with that program to see if your child is going to be eligible. But let's say the camp, we talked about our fiscal year. Let's say the camp doesn't start till July of 2024. Well, our fiscal year already started, but we could do what's called a program payment. We will pay that camp before the program starts, because all these camps and programs need to get registration. They need to get paid to get their slots. This way, your slot would be guaranteed if they were approved to go to that program. So, for example, there's one, Jessa sponsors a camp. Registration opens in November. Families will call me. They've been enrolled. They're like, hey, I want to send my kid to camp. Enrollment starts in, I get their registration form. I approve their hours in January. So when it comes to July, the camp's already been paid for. And we'll do that for program payments. But again, you have to make sure your child is eligible for those programs. Applying for respite does not guarantee them. We actually have guidelines about that as well that I would be sharing with you.
So I have a question.
Surely enough.
So those programs, do they have to be certified and approved by the ARC or anything like that?
So they have to be part of our consortium. So we work with, again, a lot of camps, the big ones that most of you have heard of, the Easter Seals, the Green Top, the League of People with Disabilities, BART-T. We work with the Lions Club, their camp for diabetes. So many of the clubs, and we also work with therapeutic programs for smaller children. We work with Basic Concept. They have a summer program. A lot of speech and language organizations will have a summer program. So we work with such as Basic Concept. We work with Creative Arts. We work with Spirit Fit and Health, who's got an ongoing program. So, and we're willing to look into any other program that may be eligible to join our consortium. We just onboarded Play on Words over the summer and Create Arts Center. I'm looking to we work with the Medicaid Accessibility Medcare. They have a program called JET. That's like they have a after school program, and then they have a summer program. So we work with many people, and if you find something, as long as they meet our criteria, then we could onboard them as well. So I'm always looking to especially like most of the seniors that use respite for in-home or respite facility, an adult medical day. Some use it social, but most of the families are looking that have children and adults with disabilities. They're looking for a place where they get a break from caring for them, but they have a place where their child can go and get some socialization skills, interact with other people, instead of being so dependent on their parents. And that's what everybody wants their child to be as independent as possible. So therapeutic programs, I think, are really a good fit for children and adults with disabilities. And we work with many programs, and I'm willing to look into any program that you may have. It can't be educational, or it can't be medical. It's got to be more therapeutic, like a camp or a summer program.
So here's a question. So you've mentioned Easter Seals, and you've mentioned Camp Pals. They have programs all over the country. So for the respite care, does it have to be in Montgomery County? Like, where does it have to be? Is there flexibility where it's located?
It can only be in the DC, Maryland, Virginia area. Can't go outside of that.
Okay, so the DMV. Yeah. Okay. So
in Camp Pals, they have one at Georgetown, and one at
UMBC.
So most of our kids go there.
Okay.
They go to Camp Pals.
Okay.
Yeah.
And are there age restrictions? Like with the daycare, it was a little different, but
to apply for respite?
No, like these types of programs that you're talking about, do they say, oh no, you can't do it, she's 14?
So when I put this list together, I want to break it out by ages for you, okay? I'll send you the link, but I'll break it out by ages for you. You just got to give me some time to do that. That's been something awesome. I've been wanting to do. Yeah, so that's why we don't provide a list of families. Let me have a list of providers. Well, first of all, the providers have to make sure their license insurance are current. If they're not, we can't refer them to you. Mm-hmm. And then secondly, they change. Okay, I got a message today. Someone told me, I don't know how true it is, but someone's saying that Easter Seals is not accepting certain funding from a certain funding source. Like, I didn't hear that. So we don't guarantee that,
your list is going to be current all the time.
3 years ago, COVID came out and all these camps shut down, all the adult medical days shut down. So again, that's why we don't publicize the list, because things could change. And then once it gets publicized, then it goes to everyone else. And then they just say, well, I've got this list. So that's why we don't do it. Because we don't want to disappoint people.
Jules, Julie asked a really great question, and I gave a basic answer that you gave me, because we talked about it for about 30 seconds. It was the same question I asked you about lists.
Yeah.
And so I'm wondering if you could give a little bit more of an in-depth answer than I just kind of typed out.
Hi, Julie. How are you? So you can't use list funding and respite funding for the same camp. So you can't say, well, I'm going to use my list funding to pay for this camp, and then I'm going to use respite to pay for the rest. You can't do that. Okay. So what you want to do is use your list funding for something and use your respite funding for something else. Okay. They cannot be used for the same program, and they cannot be utilized at the same time. Does that make sense? Great. Yeah. So as you know, did you get list funding, Julie? Oh, well, I hope you do. I hope everybody does. And if you don't, I'll put that as a resource down there. I'm also going to put in the email some other resources that you can use. There's a really good special needs navigator, Eric Jacobson, who has a great website, True North Disabilities. He's a father that was married. His wife suddenly died, and he was left alone to take care of his son with autism. And he's been caring for him. His son's an adult now, but he's navigated the world of disabilities for a while. He has some great podcasts, some other resources. Obviously, I'll put MC Transitions in there as well, but I'll also provide you some resources for age appropriate.
Elisa, did you have another question?
Yeah, really small, very specific one. So like I said, our child's 17 going on 18. Like, which one do we apply for? It seems like the
when is she going to turn 18?
February, but we'd like to pick our daughter up at college in like May. So she'll be 18 then, but she's 17 now.
Mm-hmm. Is she going to college?
No,
Okay. Your other, okay.
our other child. It's hard to take care of our other child.
I think you should apply for her as a child, because she technically is. And then once we get you situated in here, and like you were talking about going away, as long as she's 18, we'll be safe. But yeah, you should go ahead and still apply for the child's app.
Okay, thank you.
Mm-hmm. Then the following year, when you renew, you would apply for it as an adult.
Okay, thank you.
Are there any other? These have been really great questions.
They've been awesome.
I've learned so much. Oh, Christy, I see your hand is up.
Hi, Christy.
And for those of you who don't know Christy is the new family and medical outreach coordinator for DSNMC. She's recently been hired, so here she is.
Hello. Hi, everybody. I just wanted a quick question. So my son's 6, and I mean, we do a lot of things together. I was wondering what kind of services families with young kids usually use, or, I have 2 other kids, so we all kind of family together, but I'm just wondering.
So Montgomery County has a great program for children ages 3 to 13. It's called My Turn. It's a little known secret in Montgomery County. And actually Joy used to be a part of that. Joy also used to work with the ARCAs.
She didn't tell me.
Yeah. So My Turn program is a great resource for parents because they help you apply for services, for adult services. They talk to you. They'll help you with lists. They'll help you with other waiver services that you may be eligible for. And they pay for some camp and swim classes as well. So I'm going to send you that too, but that's between the ages of 3 to 13. And there's only 2 employees that work there for this program. I'll give you the number and I'll give you their names.
Okay. Thank you so much.
You are so very welcome.
But the other thing I think that Jules also mentioned is basic concepts for a summer program.
Yeah,
and my daughter did basic concepts when she was little for a few years, and it's a fabulous therapeutic camp where they do occupational therapy. It's a speech therapy camp, but they.
But do you have to be potty trained?
Yes. Yes.
I don't remember.
Yes. So no,
that's such a stinker. That's such
Yeah. So and we had that. We onboarded.
Thank you, Brooke.
We've been working with Basic Concept for a while, but then we reached out to another program, Creative Arts Center, and most of them do want your child to be potty trained. Even MoCo Recreation requires it. Yep. It's just a legality. Yep. Now, I know Camp Greentop, the overnight camp, they take children that are not, but usually they're 7 years or older. I don't recommend overnight camp for anybody under the age of 7. I think it's a little, it's harder, and especially if you have a child with special needs, it may be even more difficult. But there are a few out there now. Some camps allow you to bring an aide, but you might have to pay for it. So, or you might have to be an aide could be with your child. So yeah, it can be challenging.
Okay. Thank you. Yeah, I know. I mean, I get it, but at the same time, when it's supposed to be camps for kids with disabilities, I feel like that should be a given.
Yeah. You would think so. Yeah, you would think so.
But, yeah, thank you so much.
You're welcome.
I wonder if anyone else has any questions who hasn't had a chance yet.
I did ask one before there. If the Jules before you had like a limitation on the income of the person receiving respite, like the person with the disability. And, so is that lifted too?
Yep. Okay. So, for example, if you wanted to apply for Ramon, and we wouldn't ask for Ramon's income. We wouldn't ask for your income, and we wouldn't ask for Ramon's income.
All
So
right.
now you could apply for respite for Ramon if you wanted to,
Yeah.
and you could use those hours for some of the activities he does.
Yeah, it's good to know.
Yeah. So that's been lifted, and we're hoping that it continues to stay that way. We're certainly serving a lot more children, and most adults just receive their SSI, and that income would make them eligible when we had the eligibility. But there are some that work, and they're not going to give up their job. So it's nice to know that we can help families.
Yeah, because they need it just as everybody else.
Absolutely.
They have a job doesn't mean that they're not going to need it.
Yeah. So. And it really depends on their services. So Ramon only gets case management, right, Heidi? He's not getting any kind of.
He has half an hour twice a month.
For his job, right? In case management.
Yes, but it's like a half an hour of online.
Yeah. I would love for you to apply for Ramon.
Mm-hmm.
And we can figure out something.
The question is, I don't know if it was you or somebody that told me about a few months ago about the in-home, safe in-home agency or group that gives supports away from home, just like you're talking about. Somebody would need a reminder, a phone call, or something like that. So whatever it is that the person needs, but it requires somebody to be at the house. And they are now approved by DDA, and we are working on having a meeting maybe next month, at the end of the month, maybe October 25th or so, from the transition times, and they are going to be talking about it. And that I think you should work with them. And the Beth, I forgot her last name, and she should talk to you. I think
what is that called again? What is that called again?
Safe in Home.
Safe in Home.
Yeah.
Yeah, there's a website there and has lots of cases and examples. And we asked them to tell more examples next month to see,
And that's a really good idea, because there are some individuals that just need that, it's like a telehealth, but like a check-in. They use it for seniors as well, to check in, monitoring and stuff. Unfortunately, respite has to be done in person. So we can't, if you find a therapeutic program that's virtually, we can't support that.
Mm-hmm. Yeah.
But that is a great idea, Heidi, for Elisa. That's just a perfect scenario for you.
I don't know about the ages, if 17 would be it, but no, they are. There's a new agency. There's your need, then I think they should follow the needs of the people that need it. So, and I think they're very much open-minded. So don't miss that meeting. I think it's going to be October 25th, but we're not so sure yet, because we're waiting for them to organize it now.
How do I find that meeting?
It's going to be. Are you on the Down Syndrome Network group?
No, but I am on that MC Transitions.
They're announced everywhere.
Oh yeah, it's if it's on MC Transition, it's everywhere. Yeah, that's why, Linda, it's really important to sign up for that, because you'll get so many notifications about some great information.
And Rita is one of the organizers too, so she's the one who actually suggested that. So you will hear it soon. So
what was that again? I'm sorry, I missed part of it. I was reading over here. I missed what you were saying. You had said something to me.
I think I put something in there too about asking Jules about if she knew about the service, but it's a Safe in Home, and they will do that. They will look at your needs and try to figure out how they can do as remotely as possible. I mean, without minimal interference, but just to give the support the person needs, and they're being approved by DDA. So we want to hear more about it, and they want to hear more from you so that they can learn what is it, how can they, create some new solutions for our problems, all of our problems.
Okay, yeah, well, thank you, Heidi. If you get a chance, can you send that to me as well?
Yeah, we don't have anything written yet.
Yeah, okay, but when you get it, and I'm sure I'll see it on MC Transitions.
Yes, and PCR is going to announce too. So.
Oh, okay, cool.
We're going to get that. So everybody's going to get that. So, but this is interesting. We had a talk before with her, and it was very, it's good to know that somebody is open to figure out, solutions for problems that are not the regular problems, we have a little tiny something. How do you solve that? How do you solve that? And there's somebody else to figure that out with us. So just like Jules guy, talk to Jules, and she's very creative and she knows a lot about many other different things. So, and she can tell you and help you think, brainstorm is what you need, because parents are very resourceful. Parents
Yes.
can think about all kinds of things to solve the problem with the kids, but where are the resources for that and the supports for that? So agencies and the parents working together, that's the team. And don't forget the main part, the person with a disability, who you want to help, no matter what age they are. You have find a way to ask them and let them tell you what they need, what they like, because if they buy into it, that's why it's going to work,
Right.
So that's the idea. And sometimes they're telling with their behavior what they want, not with words. So.
Yep. Totally agree.
Yeah.
And Alyssa, I don't know if your daughter would be interested in, sounds like she's had some medical needs, but Potomac Community Resource has a respite, once a month respite program for young people who have more medically needs. They have 2 respite programs. So it's Potomac Community Resources. They're a wonderful program as well. And I'll have that in my list, but it's called Potomac Community Resources.
Okay, thank you.
Mm-hmm.
That safe and home looks kind of like what our child could tolerate. I think that looks like a really interesting thing that I hadn't learned about before. Thank you. Yeah.
I know they're using that sort of model with seniors as well now.
Yes, they are. So they do that. So, yeah.
Yeah.
This has been really eye-opening. I did not realize that respite care was open to so many people, and that it wasn't income-based anymore. And I think that I know that many families within the Down Syndrome Network of Montgomery County are going to be very interested to hear more about this. I know that not everyone who registered for this presentation was able to come, but we will certainly make sure that our members at least know what's available to their loved ones.
And Brooke, if you want to set up a meeting, later on to get parents to come to the ARC, I could set up a time where we can get the applications to the families, they bring it in, and have it all filled out, get their supporting documents, and we'll get them, approved on the spot. My goal is to help as many families as that I can. So especially while these income restrictions are in, and the more parents we hear about, and the more parents that talk to their county exec, talk to their councilman and saying, this is the only program that's going to help me with services. We need more funding for it. And you need to keep the income restrictions lifted. So
I wonder, is there anyone in your office that can provide the presentation that you gave earlier this evening in Spanish?
Sure.
Because we have a huge Spanish population within our community, and I know that we were going to have interpretive services or interpretation services this evening, but nobody registered for it that way. But I wonder if we offered it specifically in Spanish and then advertised it on our WhatsApp.
So what would happen is that I would deliver it in English, and then we have one of our staff members who's bilingual. Rosa Heidi is back in respite.
Okay.
She could transport. If you needed, I told Joy if you didn't find a Spanish interpreter, we can get one as well. And also because we are a contract of the county, we can also get a language interpreter. Just so you know, in respite, there are 50 different languages spoken, and our agency speak 27 of them. So we have agencies that speak Tagalog, Spanish, Twi, Chinese, Korean, and many other languages. So that is something that we always try to look for. That, like, if they have, and that's especially true in our senior world, not so much in the children. Spanish is the most common one for adults with disabilities.
Sure.
And we would love to support more of the Hispanic community because, unfortunately, they tend to not, they tend to be a little bit more leery in applying for things.
But I think that if the families realized that it wasn't necessarily in home and it was for it could be used for therapeutic services and for camps, I think that there would be many more families like myself that would feel more comfortable applying for these services. I'm going to apply. Like hearing what you've said, there's no reason for me not to apply.
Absolutely. And actually, we're working on a project that's we're going to show short clips of videos in different languages on how I use my respite hours. Just basically short clips that will tell other families, this is how I use my respite hours. Because when people think of respite, they just think in-home care, but it's not. It's more than that. When I first came into this program, one of the things I wanted to look at was supporting more children. And I looked at, I helped co-develop a special needs camp many years ago. And I think camp is such a powerful program, and children just make so many connections and memories to camps. It's just a wonderful program. And I think it's very, very therapeutic for everyone. And it really does give the family a break. They don't see their kids for a week and they don't have to worry about their care. It's great. And all parents need a break from caregiving. It's just way too much for them.
Jules,
hey, Heidi.
What are the requirements for becoming a caregiver? I mean, like a respite caregiver? Because is that on the website too now?
No, that's something we are working on. So we don't allow for any independent contractors. All our home health care agencies have to be, this is just for in-home agencies, okay? All our home health care agencies must have a registered service agency license in the state of Maryland, okay? So for in-home respite. Now, if you're a therapeutic program, if you have to have insurance. You must be able to demonstrate to us that you conduct background checks. So our therapeutic programs are easier to onboard than our home health care agencies. We have a lot for seniors, and we have about 10 that support adults and children. It's very difficult. Under the age of 7, it's very difficult. There's not a lot of them. But we're working on that, and hopefully we'll get more agencies to take that on. It's just a lot more, the insurance is a lot more expensive. The risks are a lot more expensive. So we do work with a few autism waiver providers.
I would think it maybe, I don't know, maybe I'm wrong, but maybe if to reach out to more like for the Latino group, if they have someone that takes care of their child and it's a small agency or something, it doesn't matter if it's a big agency, right? It could be a small agency. Maybe
we have several agencies that work with children that we have Spanish speaking caregivers. So we actually have at least 10 of them that are Spanish speaking and work with children with autism.
Okay, so they need to know about that, because I think
they do, absolutely. And you know what, too, one of the things that would be nice is that if we had it in person, and we could have some of our agencies that speak a diverse languages at that program. So we'd be happy to do that. We'd be happy to host something. If you can create a flyer, we'll get it to our communications director. And then we can, if you publicize it, give it, a couple months, we'd love to do that. We have several bilingual staff at the ARC. Rosa speaks Spanish. I can definitely get some other people to help out as well. And we have care agencies that we can ask them to bring their caregivers in and they can meet them. I think it's really, for me, Zoom, this is great. This is a great way to connect with people, but still personally, I miss the days when I get to meet the parents in person. So I really enjoy that. And I just think it's easier to make a connection. Although this is a great way to meet many people at once.
Yeah.
So we can try it. I think that I have a couple things. One, Heidi, we could probably schedule somebody for sure through Zoom at the Grupo Latino meeting. We have a Grupo Latino meeting that meets once a month.
Mhm.
And so that's a way to start. And then maybe we could try an in-person. We have not done an in-person presentation like this in a long time. So I have no idea if people would register for it or
Mhm.
not. I would say that I did go to my first in-person PTSA meeting last night and was shocked by how many people showed up, because I thought I was going to be the only one. And there were probably 40 people there, which was very impressive for a PTSA meeting. I don't know about yours, other schools, but the other thing that I wanted to just say, I don't know, Sakina and Mimi, did you guys have any questions or anything? Because you guys are sitting nice and quietly, and I know who you guys are, and your adults or kids and are. So I didn't know if you had any questions.
Thank you. I'm sorry I had to join late. I had an unexpected trip up to Rockville and back again after dinner, so I was late joining. So I'll look forward to seeing the slides or hearing more of that. But I'm actually really excited to hear that there are additional options. The only question I had was, we're in the thick of the we just got our SSI. Abby's 21, and that's a long story why it happened now and not earlier. Partly because she 18 2 weeks before lockdown, but also we're waiting on our DDA waiver application, and part of our budget we're doing self-directed. Part of our budget included a line item for respite for a certain amount per year. Did I understand you to say that we're allowed to apply for additional sources of respite, even if that's granted, or no?
No. So if you're self-directed, you would not be eligible for our program if you get personal support or respite. And remember, DDA respite is different than county respite. So the respite coordination through the ARC is funded by Montgomery County's Department of Health and Human Services. Your DDA respite is funded by DDA. So you would not be eligible. You cannot be eligible for DDA respite and our respite.
Okay.
So again, what you need, and as someone said earlier, they're eligible for DDA respite, but they just can't find any way to deliver that. So I'm gonna, in my list, I'll have some in-home agencies that you'll be able to reach out to. You just want to make sure you tell them that this is DDA respite, not county respite. And and if it's self-directed, as someone said, it does not have to be a DDA provider. You're good to go.
Okay. All right. Thank you.
You can apply for now. You could apply now because you don't know when your services are going to,
Well, we've actually been because of the holdup with they're having right now. There's like a big lag. They've approved people who have approved PCPs to move forward with services.
Oh, good.
And as long as your vendors will accept back billing. So we just started her day program last week because we were nervous about the SSI. They were basically holding it until her SSI got approved. And so hopefully it'll be complete soon.
What day program is she going to?
Sunshine Projects.
Oh, okay, good. That's great.
Yeah,
well, congratulations. I'm sorry it took so long, but I'm glad you're getting something now.
Yeah, thank you.
You're welcome.
It is, I was just saying it's 8:48 and I don't want to hold anyone up for the evening, but I just want to thank you so much, Jules, for answering all of those questions, because I think that you certainly cleared up a lot of misconceptions, I think, that many of us, including myself, had. So Joy and I will definitely connect with you so that we can follow up with folks that were here tonight, and then we will certainly share this information with the Down syndrome community.
Yeah, and if you wouldn't mind just giving me till next week, I have the next few days I'm just loaded with family orientations, but I will get everything to you.
Of course. We I'm booked for the rest of the week anyway. And so thank you so much for
you're so welcome. Everyone. I really enjoyed it. It was so nice seeing and hearing from familiar faces and meeting new people. So I wish you all well and apply for respite, and I'll do my best to support you. Take care and have a wonderful evening. It was my pleasure.
Thank you.
You're welcome.
Thank you.